If you're over 50 and your knees have started talking back a little louder than you'd like, then listen closely, because what I'm about to tell you might completely change the way your knees feel over the next few weeks. You know that sharp little pinch when you stand up from a chair? That dull ache when you take the stairs? Or that uncomfortable grinding feeling right behind the kneecap when you walk a bit too far? Most people think that's just aging, that it's just something you have to live with, but what if the real problem isn't your age, but a tiny muscle in your thigh that's been quietly getting weaker year after year? And what if strengthening that one muscle, just one, could dramatically reduce your knee pain, improve your balance, and make your legs feel stronger and more stable than they have in years? Stick with me because today we're diving into the powerful role of the VMO, the vastus medialis oblique, the teardrop-shaped muscle on the inside of your knee that controls the way your kneecap moves. And if this muscle is weak, and it often is in people over 50, that's when knee pain sneaks in, especially pain from things like patellofemoral issues, arthritis flare-ups, or general wear and tear. But here's the good news. You can target this muscle directly, safely, and effectively with just a few simple exercises. And the best part? You don't need a gym, you don't need equipment, and you don't need years of training. Just you, a little consistency, and about 10 minutes a day. Before we get into the exercises, let me tell you something most doctors won't take the time to explain. Your knee is basically controlled by your quadriceps, the 4 muscles in the front of your thigh. But they don't all work equally. When the VMO is weak, the outer quad muscles pull harder. It's like having 4 people holding a rope, and one of them is barely helping. What happens? The stronger ones overpower the weaker one. And in your knee, that means the kneecap gets pulled slightly sideways. Not enough that you can see it, but enough that you feel the consequences: aching, popping, catching, stiffness, swelling, and that uncomfortable pressure behind the knee when you straighten or bend. But when the VMO gets strong again, it pulls the kneecap back into the right groove, like putting a train back on its track. Suddenly everything moves smoothly again. And that's why these 4 exercises can feel like magic, especially if you've been suffering with knee pain for months or even years. Now let's start with exercise number 1, and I want you to really focus not just on the movement but on the muscle you're trying to wake up. This first one is called the VMO quad set, and it's one of the safest, easiest, and most powerful activation exercises you can do. Imagine sitting on the floor or on your bed with your legs straight out in front of you. You're going to tighten the front of your thigh as if you're trying to press the back of your knee down into the floor. But here's the part most people miss. You're not just tightening your thigh, you're squeezing the inside of your knee, right where that teardrop muscle sits. The contraction should feel like you're trying to make your knee smile upward. When you do this correctly, you'll feel a firm tightening along the inside of your thigh, not just the top. Hold that squeeze for 5 seconds, relax, and repeat. And when you repeat it enough times, something incredible happens. Your brain reconnects to that muscle. Remember, muscles don't just get weak from lack of strength. Sometimes they get weak from lack of attention. And this exercise turns the light switch back on. Now let's move into our second exercise, one that really gets that VMO firing, but in a gentle, controlled way that's perfect for someone with knee pain. This one is called the terminal knee extension, or TKE. Don't let the name intimidate you. It's very simple. Stand near a wall or counter for support. Imagine your knee is slightly bent, and your job is to straighten it fully, slowly, carefully, and with control. You want to feel that last 2 to 3 inches of motion in your knee. That final straightening is exactly where the VMO works the hardest. Think of it like locking a door. Most of the turning is done with big muscles, but that last little click that secures everything? That's the VMO. When you perform this exercise, focus on the inside of the knee tightening as your leg straightens. Hold for a moment, then release and repeat. It may not look like much from the outside, but inside your knee, you are training alignment, stability, and control. Alright, now let's talk about exercise number 3, one of my personal favorites because it not only strengthens the VMO but also improves balance, coordination, and knee stability all at the same time. This one is the step-down VMO variation. Most people are familiar with step-ups, but step-downs are even more effective for knee pain because they train the knee to track properly under load. Stand on a low step or even a sturdy book or platform. Slowly lower one foot toward the floor as if you're lightly tapping your heel down. But the key, yes, the magic key, is keeping your knee aligned directly between your toes and your big toe pointing straight ahead. If your knee caves inward or drifts outward, stop and reset. The VMO's job is to keep the knee centered, so if you do this correctly, you'll feel the inside of your thigh working harder than usual. And let me tell you, this exercise may feel humbling at first. You may wobble. You may shake. You may feel like your knee doesn't want to cooperate. But that's exactly why it works. You're training your knee to stay stable in real-life movements, walking, stepping, climbing stairs, movements you do every single day. And when your knee tracks properly during these activities, pain decreases significantly because alignment is being restored. Now let's move on to exercise number 4, the one that ties everything together, the one that builds real-world strength you can feel immediately in your daily life. This one is the VMO targeted wall sit with heel lift. Now, wall sits on their own are already good, but when we tweak them slightly, they become one of the best VMO builders available. Stand with your back against a wall and slide down just a little, not all the way, especially if you have knee pain. Now here's the key. Shift your weight slightly toward your heels, lift your toes very gently off the ground, and squeeze the inside of your thighs. This position forces the VMO to take control. You're not trying to go deep, you're trying to go precise. Hold for 10 to 20 seconds, rest, then repeat. You might even feel a warm burn right above the inside of your knee. That's the VMO waking up, strengthening, and pulling your kneecap back into healthy alignment. And don't worry if your legs start shaking like jelly. That's normal. That shaking is your muscles learning, adapting, and rebuilding. Now let's talk about something important. Why strengthening the VMO matters not just for pain relief, but for your future. Because knee pain isn't just about discomfort. It affects your mobility, your independence, and even your confidence. Think about how many times you use your knees in a day. Getting out of bed, standing up from a chair, climbing into your car, going up and down stairs, walking across the room. When one movement hurts, your entire life shrinks a little. You take shorter steps. You avoid stairs. You sit more. And all of that makes things worse because the less you move, the weaker the muscles become. But when you strengthen the VMO, something amazing happens. Movement becomes easier again. Pain decreases. Stability improves. And you start moving with more confidence. And confidence is a huge part of staying healthy over 50. Because when you feel strong, you act strong. And when you act strong, your body responds. Now, one thing I always tell people is that knee pain is not always a sign of damage. Sometimes it's simply a sign of imbalance. The muscles on the outside of your thigh get tight and overactive. The muscles on the inside get weak and underactive. The kneecap gets pulled slightly out of its natural groove. And the pain shows up like a warning light. Strengthening the VMO helps pull everything back where it belongs. Think of your kneecap like a boat drifting in the wrong direction. The VMO is the rope that pulls it back to the dock. Let's take a moment and talk about something else most people overlook, your mind-muscle connection. When you do these exercises, especially the first two, I want you to really focus on the inside of your knee. Visualize the muscle tightening. Studies show that simply thinking about the muscle you're working can increase muscle activation by up to 20%. That's like getting extra results just from being mentally present. Now, maybe you're wondering, how long will it take to see results? Here's the truth. Most people start feeling a difference within 3 to 7 days. It's not because the muscle suddenly gets huge, but because activation improves. The VMO wakes up. The kneecap glides smoother. Pain decreases. And that early improvement becomes motivation to keep going. Around the 2 to 4 week mark, the muscle begins to strengthen in a way you can actually feel. Better stair climbing, less stiffness in the morning, and more stability when you walk. By 6 weeks, if you stay consistent, many people report a dramatic improvement in knee comfort and function. Now let me walk you through something important, breathing. Yes, breathing. When you do these exercises, especially the wall sit and the step down, don't hold your breath. That's a common mistake. Instead, breathe steadily. Inhale as you reset, and exhale as you tighten or hold. Breathing keeps your muscles oxygenated, reduces tension, and prevents unnecessary strain. Another thing, if your knees crack or pop during these exercises, don't panic. As long as there is no sharp pain, that's often just the sound of gas releasing from the joint or the tissues gliding. It's very common after 50. What matters is how your knees feel during and after the exercise. Let's also talk about real-life application because exercises are great, but what really matters is how this translates into everyday movement. Think about the way you get out of a chair. Do your knees cave inward? Do you rely heavily on your hands? That's a sign the VMO is not doing its job. Think about climbing stairs. Does one knee feel weaker than the other? Do you feel like the knee drifts inward or wobbles? That's VMO weakness. Think about walking downhill. Does it trigger discomfort around the kneecap? Again, VMO weakness. When you strengthen the VMO, all of these everyday movements become easier, smoother, and safer. And don't underestimate the connection between the VMO and your balance. After 50, balance becomes incredibly important. A strong VMO helps keep your knee stable, which helps keep your body aligned, which reduces the risk of falls. Falls are one of the biggest threats to independence as we age. Strong knees are a powerful form of protection. And if you're someone who has arthritis, listen carefully. Strengthening the VMO will not cure arthritis, but it absolutely can reduce the symptoms. Because when your knee moves properly, there's less grinding, less pressure, and less irritation inside the joint. Many people with arthritis find that the right strengthening exercises feel better than pain pills, braces, or even injections. Let me also address something you might be wondering. Should you do these exercises every day? And the answer is yes, at least the first two. The quad set and the terminal knee extension can be done daily because they're activation exercises. The wall sit and the step down can be done every other day if they feel challenging. But the key is consistency. Little daily efforts build strong, pain-free knees far faster than long workouts done sporadically. Now, let's talk about what not to do. Do not push through sharp pain. Discomfort is okay, a little burn is okay, but sharp pain, stabbing pain, or sudden swelling is your body saying, stop. Do not rotate your knee inward during exercises. That puts stress on the wrong structures. Do not rush. Slow, controlled movements activate the VMO far better than fast or sloppy ones. And don't forget to hydrate, especially after exercises. Joints need fluid. Dehydration makes knee stiffness worse. You might also wonder if walking helps the VMO. Walking is great for overall knee health, but it does not specifically strengthen the VMO. These exercises are what bridge the gap between everyday movement and targeted strengthening. Once your VMO is strong again, walking becomes easier and more comfortable, but it's the strengthening work that gets you there. Now I want you to imagine something. Imagine waking up in the morning, standing up from your bed, and feeling your knees glide smoothly instead of resisting. Imagine walking up the stairs without grabbing the railing for support. Imagine bending down to pick something up and not feeling that dull ache that's been following you around for years. Imagine taking a long walk with your family, or playing with your grandkids, or going on a trip, and not worrying about your knees slowing you down. That's not a fantasy. That's what happens when you strengthen the right muscle. And let me tell you something powerful, your body is not done. Your knees are not done. Your strength is not done. You can rebuild. You can regain. You can restore. The human body is incredibly adaptable, even after 50, even after 60, even after 70. You are not too old to improve. You are not too old to get stronger. You are not too old to feel better. All you need is the right approach and the willingness to take that first step. So if you're over 50 and dealing with painful knees, start these 4 exercises today. Be patient, be consistent, and give your body a chance to respond. Because your knees don't have to hurt. Your legs don't have to feel weak. And your future doesn't have to be limited. You can transform the way your knees feel, one simple movement at a time. And as always, I'm here to guide you every step of the way. If you found this helpful, make sure you stick around for more videos on joint health, strength training, and pain-free living. Because your best years aren't behind you, they're right in front of you. Now go strengthen that VMO, and I'll see you in the next video.